It's the spot where talents from the 254 and beyond converge just because they have something in common. Arena 254, every Saturday from 2 p.m. with Sharon Kate Nganga and Chito Lovu. You won't like it, you'll love it.
Good morning and welcome back again to K24 FG. It's Wellness Wednesday, and you know what we discuss here? We discuss matters health. Today, we are celebrating the Men's Health Week, and with me, I do have a couple of individuals who are going to be talking about various, men health issues. One of them is a doctor. I am talking about Dr. Waihenya Charles Githiaka, who's a consultant urologist at the MP Shah Hospital. We also have Mr. Vincent Ayalo, who is a prostate cancer survivor, and Newton Kinyandri, who is a recovered alcoholic. All these three gentlemen, of course, experts in different areas, as I have just mentioned. So we shall start with you, Dr. How are you doing, sir?
I'm fine, sir.
Welcome to the show.
Yes.
Mr. Vincent, karibu pia wewe.
Thank you.
And of course, Mr. Newton. Habari yako, brother?
Asante sana.
I feel intimidated. Uwanga bouncer, and be very honest, by the way.
No.
Kama unakuanga bouncer, by the way, niambie tu ndio nikichoose venye naongea na wewe, nikuwe very careful.
No, I'm not.
Okay, sawa. Remember, you can find us on our Twitter handle, that is at K24. Let me have all the questions that you need answered. The doctor is here. Do not let this guy go before he tells you what you want to know about prostate cancer and probably anything else you'd want to know as far as urology is concerned. So, Dr. Let's start with you.
Yes, sir.
There's something interesting about prostate cancer you told me, that it's not fatal. Ama mimi ndio sikuelewa.
Prostate cancer, unlike other cancers, is one cancer that we are able to manipulate.
Okay.
And the cells of the prostate cancer divide very slowly. The only problem is our patients who come late for diagnosis. 70% of the patients with prostate cancer come with late-stage disease.
Okay.
So if we are able to do the diagnosis early, then we are able to actually cure the prostate cancer.
Okay.
It is common for people to insure their cars and not insure themselves.
Okay.
They will take their car to the garage every 5,000 kilometers. But when it comes to their body, they only wait. And they will say, all my life, I've never been sick.
Yes.
Just for them to be diagnosed with stage 4 disease.
Dr. Me, I'm one of those people, by the way. I hardly get anything.
Yes.
Hata homa.
Yes.
Ni ngumu sana nipate.
Yes.
But how do I then decide, how do I even start by, let's just start by saying, how do we go about checking for prostate cancer?
One thing I want to say is that prostate cancer is rare before the age of 40.
Okay.
So if you come
rare,
to see me and I guess you're in your early 30s or 35 years, that's 7 years, I will not screen you for prostate cancer.
Okay.
But from the age of 40, especially if you have a first degree relative like your father or your brother has had prostate cancer, then I'll start screening you from there.
Okay.
If you have no history of prostate cancer in family, then we start from the age of 45, every year or every 2 years, depending on the velocity of the PSA. Okay. Now, what is PSA? PSA is a prostate-specific antigen. Okay. This is a test that we do in the blood. It is a protein that exists in the prostate. Okay. When the prostatic cells have a problem, for whatever reason, whether it is prostate cancer or whether it is infection, then it will start rising. Okay. And then from there, then we start actually looking for the prostate cancer. So what we want to say is that from the age of 40, we say life starts at 40. Yeah. Why do we say life starts at 40? It's because that's when you are going to start having all the cancers. Your blood pressure will go up, your diabetes will go up, you are going to be having stress building your house, your children are in university or high school or something like that. True. So I think just like we take our cars to the garage, when you are the age of 40, you should make it a priority every year to go for a medical checkup. Okay. Most of us will go for a medical checkup because the insurance has said, we will not insure you unless you have this checked up. Yeah. And you just discover you are diabetic.
True. All right, let's talk to someone who's actually been there, Mr. Vincent. Vincent, you like what we have, labeled you as a prostate cancer survivor. When were you diagnosed with prostate cancer?
Yes, that is, I was diagnosed with prostate cancer in the year 2014.
Okay, how old were you in 2014?
I was 72.
Okay,
Now, I may go back a bit.
all right.
When I retired from the service, I decided to go, when I lost my insurance cover, I decided to go privately for an insurance cover.
Okay,
That is when this animal PSA struck me.
okay,
I was told by the insurer that my PSA was 9 and I should go and see my doctor.
okay,
I ignored it because I didn't know what all that PSA meant. I went on my life. That was 2006.
okay. In 06, they told you go have your PSA checked.
I ignored
You
it.
ignored it.
I didn't know what it was.
Okay,
So I ignored it. 2010, I began having some problems on going to toilet every now and then. I ignored it.
all right.
2014, it was excessive.
And just to be clear,
Yes.
this problem, was it the long call or the short call?
Yes, it was the short call.
Okay,
The short call to visit the toilet 6 times a night.
at night.
Yes.
Okay,
Sometimes I feel like going to pee or to go for a short call, and nothing
Nah,
comes
nah.
out.
okay,
On the way coming back, I feel like going back again. Then I get very little coming out. And I come again. Then I say, there must be a problem now.
okay,
That's the year 2014. I went and saw a doctor who recommended I go for another PSA.
okay.
It was found 128
128.
in 28.
This is from the previous 9
9.
in 2006?
6, yes.
Okay,
Then I asked the doctor, what's all this PSA talk about? That is a measure of cancer in your body.
wow.
He used the word measure. Now he has just explained it. Then I went for another test because I didn't believe what he was telling me. It was found to be 148. From 128
And in a span of how long?
in a span of 1 month
It had shot up by 20.
by 20. The doctor told me you need to see an oncologist.
Okay,
You need to be attended fast. This cancer, if it is there, is growing very fast.
okay,
And I was told, before we know it is cancer, you go to a pathologist to confirm to us that this is cancer,
all right.
and not just simply enlargement that's pressing the urine path.
Okay,
But that enlargement is actually cancerous. This can only be confirmed by a pathologist.
all right.
This was done and was found to be cancerous.
So the test, what kind of test was it done? Did they extract some blood? Did they do an X-ray? Did they do what is it? Ultrasound? Did they have to operate?
They did all those X-ray, ultrasound, but the major one was the one for the pathologist. They get into rectum and they reach the prostate itself.
Okay,
And a device, technically accepted, they remove pieces of
a tissue,
tissue from
Okay.
the prostate
and then they
to
tested
be
it.
tested.
Okay,
This is done by a pathologist
all right.
who confirmed that I had cancer.
Okay,
Now, they had to stage it. What stage is that cancer? There was a bit of confusion.
all right.
You know, Some said it was stage 3, late stage 3. Others interpreted it as early stage 4.
Okay.
So a layman like me did not know what all those meant.
I don't, Newton, do you understand what Mzee here is saying? About you're floating as I am.
Yeah,
You're kind of floating.
just a little bit.
Yeah.
A little bit.
Before I get to him, because his case is a bit different,
Yes.
he's mentioned two things that I just want to again clarify from
Yes,
you.
yes.
First of all, tumesema PSA is prostate specific antigen, which is a protein
Yes.
that is produced by the prostate.
The prostate.
All right.
Yes.
He has mentioned that it was the first time he went, it was 9. Then he went again, wakangale, it was 128. Then the third time they checked, it was 148.
Yes.
For a normal human being
Yes.
like myself,
Yes.
I am 33 years old.
Yes.
What is my PSA number? Level rather.
The PSA actually depends on your age. For example, you who is below 40 years, I expect your PSA to be 0 point something.
Okay.
But
0 point.
0 point something in the blood.
Okay.
But when you start growing older, by the time you are 65, we allow you to have a PSA of 6.5 and we say it's normal.
Okay.
But remember, the PSA is not specific for prostate cancer. You can have prostate cancer, yet
Right.
you have a normal PSA.
All right.
So we have never had a tumor marker or a prostate cancer marker that is specific for prostate cancer.
All right.
Where just like when you do a pregnancy test, it is positive or negative.
All right.
So prostate cancer is a little difficult. But having said that, I want to say this. Do not wait for symptoms to be diagnosed with prostate cancer. Prostate cancer does not present with the symptoms in the early stage. If you are having symptoms, for example, like he has talked about, where his urine flow is poor, he wakes up 10 times in the night, he sometimes has to wait to pee many times at the same time, or sometimes finds that his bladder is not completely empty.
Right.
By the time you are getting there, usually you will have a prostatic enlargement.
Okay.
But if you have prostate cancer, most likely you have a late stage disease.
Okay.
So just like for practical purposes, we always say if your PSA is below 4,
Okay.
chances of prostate cancer are very low,
Minimal.
very minimal.
Okay.
And the reason we want to do that, he has talked about how we diagnose prostate cancer. Ideally, it is the urologist who does the prostate biopsy. We'll put a probe, of an ultrasound probe,
Okay.
into your rectum. We will map the prostate and do several cores. We use a thin needle and a local anesthesia in the office. We remove small
Local
pieces.
anesthesia, this means I am awake, but
You are awake.
uko nyuma niko numb.
Uko numb.
Okay.
We'll give you some injection into the prostate. Then we'll take a few pieces of the prostate. It's like when you are looking for oil.
Okay.
In Tulo.
Yes.
You drill
Turkana.
here, there is no oil there, then you drill. So
another
you
place.
drill like 6 to 12 holes.
Sasa hizo tu nimekaa tu hivi.
Lakini usikii uchungu. There is
So, I mean,
actually no pain.
Daktari, I just want to know, how many injections will you give me before you
No,
get
we
in
are
there?
just going to block the nerves. They are
Okay.
actually just 2. And you know what? We also use a gel,
Yes.
a gel that actually kills pain,
Okay.
that actually lubricates. Then we put a probe there, and we are able to see your prostate on a screen like that.
Okay.
And then we are able to take small pieces. Those ones, we take them, we preserve them, and we send them to the pathologist.
Okay.
The pathologist will look
Will
at
now
them under
determine.
the microscope, and will actually tell you, is it prostate cancer, or is it just benign disease, or what we call no cancer.
Okay.
Yes.
All right.
Yes.
Nimeelewa. Mimi hapa kwa sindano hapo tu daktari kwa watu hapo mimi amwenidoki. You either tell me muniekelee mikono muniombee ipotee. All right, let's get to Mr. Newton here. We shall get back to cancer in a minute. But Newton, your case is a bit different because we are celebrating Men's Health Week. You recovered from alcoholism.
Yes.
Newton, how old are you?
I'm 27 years old.
27.
Yes.
How long have you, or rather, when did you start drinking?
When I was 20.
When you were 20.
Yes.
And how long did it take for you to recover? Or rather, for how long were you an alcoholic actually? That's the question.
Around 5 or so years.
Okay.
Yes.
So between the ages of 20 and 25, ulikuwa ngolem so drinks na mayengs.
Yeah,
Yeah.
but actually it gradually increased with time.
Okay.
Because obviously when you're engaged somewhere or even employed, you won't go maybe very drunk or drunk in this case.
I want to know the genesis. 20 years old, right? That's when you started taking alcohol. What introduced you to alcohol? Was it friends? Was it your parents? Ulikuwa unaingia kwa kabati unaona manzi ile whisky ya father ndio yeye unavuka nayo. How did you start?
It was friends actually, because at this particular age most of the guys within that age group hang out mostly maybe in clubs.
Yes.
Yeah, then you'd feel out of place not having a beer or two.
Okay.
So it started off, though it wasn't that serious. So with time it gradually increased, and that's when now recently it almost got out of hand.
Okay.
Yeah.
So you started off because again I just want to understand.
Yeah.
Ulianza na like beers, or you started with changa, illicit the illicit brews, akina busa, because traditionally it's accepted uko ushago. Or when ule msemanzo ulianza tu na the hard whiskey, the single malts?
No, nilianza na beer.
Okay.
Yeah.
All right.
And beer is reasonable. When you have two, at least you can manage to do like everything. So with time it gradually increased, and it reached to a point when I would not feel now the effect of the beer.
Okay.
So I had to go for the next best option. Yeah. So I went for the whiskeys. So all along I've been having whiskeys till recently. Now when I was not like formally engaged anywhere, now I'd go for the other brands, but not changa. Yeah.
Zenye unaweza afford. Zile unaona ule msee ile ni brand gani yani how much ni so moja nipatie hiyo. All right. That's how it. And how dependent were you on alcohol?
It reached to a point where I'd feel almost dysfunctional without a drink. That is when I wake up in the morning, the first thing that would cross my mind was to have something small so that at least the system could boot. So
like literally that was your fuel.
Yes.
Sasa zile mimi nafikiria niamke na masausage, bacon, wewe unamko ukifikiria tu vodo.
It had reached to that point. So even after maybe partying the previous night, you'd carry something small for asubuhi.
Kutwa lock.
Yeah.
All right.
So when I wake up, I'd hit something small. So it went that way, and unfortunately, those friends that one usually hangs out when you're in that stage, your pesa ya pombe haikosangi sana. So it reached to a point where maybe most of the time I was kind of high, and now there were those suggestions by close family friends that I think you need some help, but for any alcoholic you'll be in denial. You'll never like accept that alcohol has taken over you.
Yeah.
So I tell them, no. As you can see, people who are alcoholics, you find them maybe sleeping somewhere kwa mitaro. Yeah, but that has never happened to me. If you listen to my reasoning, I'm way better than yeah.
You have logic.
Yeah, I have logic.
Yeah.
So
you're way better than the rest of us sober ones.
Yeah. So there's no need why I should go for those things, surgery rehab. So I was pushed. We went and visited a few, and now I'm here to think about it.
When you say you visited a few, like you would go, get a brochure, ask how they operate.
Yeah, now with now my family members. Yeah, because now I wanted to show them I was willing to take this thing, but now at the right time, because to some extent I also felt that this thing had taken control of my life.
Okay.
So I needed that help, because I'd wake up very well, say, hey, based on what happened yesterday, this thing, I'm not going to have it anymore. So I passed by a place, hi guys, okay. You get in. So before you know it, now it becomes very serious. I felt now I needed this help.
Right.
Yeah.
Let me ask, what is the worst episode you've ever had while you're drunk? Did you get violent, for example? Did you ulekewa mchele? Did you, I don't know, find yourself in Kisumu? Like, what is the worst episode you've ever had with alcoholism?
Kuwekewa mchele. Yeah, hiyo nimewahi at some point. So you literally black out and wake up maybe the next day at around noon in the same place. So watu ndio wanakuamsha, you left one, what happened? What happened?
Kwani jana kulienda aje?
And I only just hit maybe a very reasonable quantity of it. That has never happened to me. So, but still after that, you still feel to blow off now that steam. We mse wangu just niongezee kidogo and then we'll talk in the evening. Niongezee kidogo ndio niweze kwenda home.
Doc, I don't know. Hii mchele tunashindanga tukisema watu wamekewa mchele in the clubs and so on and so forth. Is there like a specific drug that is put in there? Is it a mixture of things or?
No, usually it is actually a drug. And if I remember well, it's a drug called scopolamine. Scopolamine.
Yes.
That drug normally will affect the brain in such a way that initially you don't black out. Somebody can lead you wherever he wants you to go.
Yes.
And once you get into the car and they rope you up, then after that you go into sleep.
Yes.
And you find yourself the following day.
Yes.
Sometimes they even use it to apply it into the female breast, you know, those kind of stuff. And sometimes they will put it in their big nails. And then they just dip it into your alcohol, especially when you go to the toilet to help yourself. Otherwise, I don't have much details on that. But that is real. There are medical drugs that are bought from the chemist.
Okay.
Yes.
Now, for someone like him, or rather other people like, you know, because he's now recovered, he's out of it, but for people who've been taking alcohol for the longest time and they're probably addicted and hooked to it.
Yes.
Is there a specific thing they can do to themselves, or even is there like a drug maybe that they can take to help them not now focus on alcohol but wean themselves out of this alcohol using this specific drug?
I think other than smoking, where we know we can use dummies of cigarettes, for alcohol, I think the most important thing for these people is once they get into the rehabilitation center and they stay there, you know, normally they will get into withdrawal symptoms.
Yes.
And that one is usually very serious. I think what the alcoholics dread is that withdrawal symptom, because they are not able to sleep, and they are also probably sometimes they even become psychiatric.
Yes.
Sometimes you have to admit them in the hospital and give them very high doses of sedatives.
Wow.
So the ideal thing is once you put them in the rehabilitation center, then they are kept without drug for some time or without the alcohol for some time, then they are able to actually realize, like he told me before we came on air, that you come to realize, oh, I can go a week without alcohol.
Yes.
The most difficult thing is after they leave the rehabilitation center, they need a lot of support.
Because they might relapse. If you
don't support them, they go back. If they don't get some means of some job or activity for them, and when they relapse, they're even worse.
Right.
But there's nothing like you can go take in place of alcohol. Maybe
katembe umeze hivi. Umeze katembe hivi alafu sitaki kukunywa pombe.
Initially we give them Valium. Very high doses of Valium just to prevent them getting those urges and withdrawal symptoms. And actually they sleep a lot. But there is no such a drug like anti-alcohol.
Hi, sawa. We take a short break right now, but when we come back, we'll look at the rehab part of alcoholism.